Berg, who is an expert in oncology, Ted Smith from the Nobel Committee, Dr. Anna Waddell, the chair of the Nobel Committee, and of course Claes. So please, if there are any questions, here we have one.
My name is Berg from China's Agency. I've got a question for the experts. So this year's medicine awards is given to the new cancer treatments. So what are the significance of this award? Are we saying that cancer has been a huge challenge nowadays for human beings? What are the significance for this award this year?
Yeah.
So this type of cancer treatment is very interesting because it works in a completely new fashion. All previous cancer treatments were essentially directed against the tumor cell, but this particular treatment is directed against the immune system. And one interesting aspect is that it works on many different types of tumors, not only on one particular tumor, but on many different types.
Here we have one question. Can you please wait for the microphone? Okay, we'll start with one up here and then. Please go ahead.
Okay, I have a question about James Addison anti-CAR T therapy. I know that another excellent scientist from Yale University, Xuefei Chen, is also a highly eligible candidate for this. Just would like to know the reason that he's not being selected. Thank you.
Claes, do you want to respond to that?
So the question was about another scientist who is not given this year's award. Now let me first say that the Nobel Committee divides the world, or the people of the world, in two groups. The ones who have received the Nobel Prize in Medicine and the ones who have not yet received it. And we love to comment on the ones who have received it, but prefer to refrain from comments on the others. Having said that, I would like to add that, as I tried to imply in this presentation, many scientists contributed to this whole field. And if you want to read about the contributions of different scientists, many of them very, very smart, clever, who contributed a lot, we refer you to the advanced information that is, I think is now out on the Nobel web, where you can read about all the contributions of many other scientists, which were also important, but these two stand out.
Okay. Here's one question.
Thank you. I'm Xuefei Chen Axelsson from Spring Post and China Radio. I'd just like to ask you that when we talk about this immune checkpoint therapy, does it mean that it is a method that narrows down the point to check for the cancer treatment, or how better it is than the previous ones? Thank you.
Could I ask Jonas Berg to answer that question?
The effects of these checkpoint inhibitors are quite remarkable because they really define a new concept where you release the brakes. Previous types of immune therapy, they were really trying to make use of the immune system by stimulating it and enhancing its capacity. But here, in that concept, you didn't release the brakes, and for that reason those therapies were not as successful as these therapies. And the fundamental thing also is that these therapies, as we are discussing today, they are apparently and very nicely working in previously quite therapy-resistant tumors, as mentioned here, malignant melanoma, different types of lung cancer, to some extent renal cancer, to give some examples. While quote-unquote simpler cancer, which have been sensitive to endocrine therapy, cytostatics, radiotherapy, etc., the effect by the conventional therapy has been quite good, but for the tumors I mentioned, the present armamentarium up until today have not been that fantastic.
Yeah, what about the side effects?
Could maybe, who wants to answer that? Maybe it's best that you.
The side effects are there, it's correct, but if you compare with other approved drugs or therapies for cancer, there are by all means always side effects. And if I compare the armamentarium, the new drugs we are discussing, the checkpoint inhibitors, the side effects are for almost all patients manageable, although they are in a scale up to 5. They are not rare with grade 3 to 4 side effects, but mostly of them, they are reversible. And it's clearly so, if you look at the benefit, namely the effect on the cancer, and then you balance that versus the risk, there is no question that there is a clearly positive benefit-risk balance for these, for the therapy of the cancers we have discussed here.
There's one up here.
This is from Nordic Chinese Times. I have a question for I would like to thank you for these two great scientists. But we have now around 1,000 clinical trials with PD-1 and CTLA-4 and with combination therapy. So we even run out of patients. So what's the next future or rational design for this combination with this checkpoint therapy? Thank you.
There's an Anna to respond to that.
Yes, I think what's most promising now, we have now a completely new tool to add to the toolbox. So it has sort of revitalized the whole area. So to find the right combination for the right subgroups and even for the right patient and go into a more individualized therapy will be a very important process. There are very many studies, of course, ongoing doing that. So there will be more concepts, more checkpoint inhibitors most likely, but combining what we already have also with conventional therapy, there's a huge benefit to doing that.
Do you want to chat some?
Yes, I can add that this is a very active field. So as late as last Friday, September the 28th, FDA approved yet another anti-PD-1 antibody, which is called cemiplimab. And I can also add, when it comes to the side effects, the adverse effects, that there are differences. So the latest drugs directed against PD-1 and PD-L1, the ligand of PD-1, have fewer side effects than the first candidates that came up. Those directed against anti-CTLA-4.
The powerfulness by combined therapy, I can mention triple-negative breast cancer in a small randomized phase 2 study. If you just give chemotherapy in 20%, 1 in 5 patients, the tumor totally disappeared in the areas which were there before therapy. If you do the combination of chemotherapy plus a checkpoint inhibitor, in 6 out of 10, 2 out of 3 patients in reality, the tumor disappeared. So it was a dramatic improvement from 20 to 60% in this very early study, demonstrating that combination for some patients could be quite useful using the conventional therapy strategies.
David Keaton from the Associated Press. It's a question for you. We saw earlier a photo of you speaking on the phone to the winners. Could you tell us a little bit how they reacted when they heard the news that they were this year's winners?
Yeah, well, what you did see was speaking on the phone with Dr. Honjo. So I didn't get in touch yet with Dr. Axelsson. You might know it now, but I never got hold of him. Dr. Honjo sounded extremely pleased. I have a little bit difficult time to guess if he had some expectancy of this news, but he seemed rather surprised, and he expressed very clearly how satisfied he was also of sharing the prize with Dr. Axelsson. Are there any other questions? So with that, I think then if there is no one else who want to ask anything, that we can conclude this press conference. And there are some of you who are asking for interviews, so we will try and satisfy all requests as quickly as we can. So thank you very much for coming. Thanks.